Hey, this is Jennifer. We're going to look at the Physical Therapy Department for East Carolina University. East Carolina University's Physical Therapy Department is rich in the interprofessional educational framework. They pull from several disciplines and have a very comprehensive curriculum that looks at many different aspects of medicine. There are portions of their curriculum that include different aspects of patient care, not only mobilizing patients, but also some of the pharmacy type issues that go into mobilizing patients. The faculty and staff that teach the programs are all prepared at the doctoral level, and even though they are all practicing physical therapists, they also represent a multitude of disciplines, from pediatrics to geriatrics, sports medicine and rehabilitation, neuromuscular and degenerative disorders, those sorts of things. Let's begin by looking at the vision, mission, and goals of the program. We are basically just looking at East Carolina's website, and so once we're finished with this presentation, if you want to go back and take extra time to look at it, that's a great option. The vision of their department is that it will be recognized in the region, state, and nation as a leader in education and clinical-based research. Their mission is that they will produce clinically competent and highly professional practitioners that will stay within the state of North Carolina to serve and practice, particularly in the eastern region of North Carolina, because the eastern region of North Carolina is technically considered an underserved region of our state, and their program actually does give preference for admissions for North Carolina residents, and especially those that live in the eastern portion of the state. So that's one thing that makes this program very different than other programs. Lots of other programs will take a lot of time to recruit students from outside states, outside resources, and then don't do a lot to retain the student base in the state in which they were taught and received their education. But East Carolina actively pursues students from the state and then actively pursues keeping them here. Part of their goals is that they want to promote excellence in teaching and learning. They want to develop a nationally recognized research agenda, and they want to increase patient care and community initiatives. These are all things that can be seen throughout different course objectives and curricula for many different medical disciplines. The nursing curriculum that we have looks very much at evidence-based learning, evidence-based research, involving students and faculty together in scholarly activities, a curriculum that promotes professional excellence, competent patient management, and the promotion of health skills, collaborating within the interdisciplinary research community, and providing an opportunity that allows faculty to be competitive in seeking external funding. Let's go back and explore some of the other portions of East Carolina's program. The DPT program itself is a 3-year program. It includes 106 semester hours of program and 32 weeks of clinical education, so that's a pretty rigorous preparatory regimen that the DPT program students go through. Their program is accredited from the Commission of Accreditation on Physical Therapy Education, or CAPT. The curriculum for their program can be found directly on their website. Although many portions of the curriculum are very specific to the discipline of physical therapy, there are also some themes that you will see occurring across medicine, such as anatomy, pharmacology, learning how to perform patient assessments across the HFAN, and also the clinical component that is required for the physical therapy discipline. I'll just scroll through slowly so you can get a grasp of what their curricula entails, and then we'll load up a separate document that actually shows that in more detail. The admissions process for the DPT program at ECU is rigorous. In addition to the candidate having a BS in another field, they must also be eligible for admission to the graduate school, which means that they have to have a certain GPA and a certain score on their GRE. But additionally, something that is unique to a DPT program is that the candidate must provide evidence of exposure to the practice of physical therapy, and this has to be achieved through being checked off with supervised hours from a licensed physical therapist. Candidates must present the school with documentation that they have completed a minimum of 100 hours of exposure to the field, and it needs to be a varied clinical experience that shows that they have been in the inpatient, outpatient, rehab, long-term care, geriatric, and pediatric populations in order to be considered. Other unique things that ECU does to prepare their potential candidates for the program is they have organizations and clubs that are available through their university. They have a physical therapy club, which is to represent the physical therapy profession at ECU and to promote physical therapy profession locally, statewide, and nationally through academic, social, and civic service. They also have a pre-physical therapy club, and through that organization, their goal is to provide students that are interested in physical therapy with information and advice about the program to give them a better understanding of physical therapy and the DPT program at ECU. This is great because it allows students to have exposure before they begin in a program. That way they really understand what they're getting into before they become involved. Another portion of ECU's DPT program is they list on their site the Essential Requirements document, and within this Essential Requirements document, it lets students know what the standards are for admission, retention, and graduation. And again, this is a separate document that we can add onto our site so that everyone can look at their leisure, but it talks about what the Doctor of Physical Therapy program is, what the practice of physical therapy involves, what the school's policy is. This document goes through part of the technical standards that the students need to possess to be successful in the program. It even discusses in great length some of the things that we'll find in Bloom's taxonomy, the essential abilities that they are required to have that include their motor, sensory, communication, and intellectual skills. Students must possess cognitive abilities that are necessary to master relevant content to the basic science and clinical courses at the level deemed appropriate by the faculty and the graduate school. They must have the ability to comprehend, memorize, analyze, and synthesize material that are included but not limited to their cognitive skills. They must possess the ability to record a patient's medical history appropriately and to also perform a physical examination. And this is a list of all the different things that they will need to be able to perform in order to perform that physical assessment. Appendix A of this document goes through the clinical performance criteria that has been established by the American Physical Therapy Association and lets students know what the 24 performance criteria they will be checked off on for their evaluation later on before becoming graduates of the program and becoming eligible to take their boards to practice as licensed physical therapists. Finally, the last portion of their website is devoted to the research that they are conducting via their physical therapy department. It looks like they have 2 different laboratories that are set up, one for human movement analysis and another for neuroscience research as it applies to physical therapy. Each portion of the physical therapy department's website at East Carolina clearly demonstrates their commitment to the Interprofessional Educational Foundation. It also shows that they are trying to link together different portions of their mission and their vision throughout their curriculum, throughout the way their faculty and staff are selected, the resources they have available to their students, the essentials that they provide with the students up front before becoming engaged within their program, and the research that is being done within their faculty that also incorporates their students and the community within which the college is located.